Nations Office on Drugs and also Crime and its protocols. So remember, as a government, as we signed these protocols, we would like to see people in the Department of Immigration not to be even threatened, but also as government officers and all members of Malawi nation to work as a team. Because those who are involved in these are those from cross-border, and they are here just to practice persons, trafficking in persons, which is not even a human rights thing to condone. We've had a number of instances, and what Mrs. Kachimanga said is really pathetic. I would like to thank you, Ma'am, and also to thank Maxwell for the job well done. You, in the Beth Israel, I hear there are a number of people who are being rehabilitated, those who were trafficked. It's really an insult, and also very bad to hear that a 9-year girl was trafficked from Palombe. And in this center, we hear there are a number of children from Palombe. Those, their parents or their relations are selling them for money. And a 9-year girl to go through that, it's really very pathetic. If some of us, we cannot even condone that. And we cannot even go through that, what more with a 9-year girl. And with what you are doing, may God bless you. And we're looking forward to bring to an end the trafficking in persons. We'll see what will happen, and I'm sure the Minister of Home Affairs is going to help us. The law enforcers as well will put much penalties, strong penalties of those who've been arrested. Mr. Matewere, let me empower you to go and trace all these persons in trafficking, even if they've run away, but I'm sure they are still within the country. But please, with the help of God, make sure that all those that are supposed to be brought to book. Among others, the Act provides for comprehensive legislative framework to combat and prevent trafficking in persons through human rights approach and establishment of an institutional framework for effective regulations and also coordination of trafficking in persons and related matters. Among others, the Malawi Trafficking in Persons Act of 2015 provides for increased participation of individuals, communities, and also institutions in the fight against trafficking in persons, and also provides for creation of shelters where victims of trafficking in persons are cared for, and this is what Beth Israel is doing. And Madam Kachimanga, we thank you very much that you are now implementing the Malawi Act of 2015. It distinguishes the offenses of trafficking in children to the general offenses of trafficking in persons, and this is what the Act of Trafficking in Persons of 2015 is all about. It also provides for aggravated forms of trafficking in persons and the penalties such as to such offenses. The Act also makes it clear that any offense under the Act amounts to an offense involving dishonesty and moral attitude for the purposes of sections 21, 51, and also 80 of the Constitution. The Act provides for care and protection of victims of offenses of trafficking in persons, giving power to the minister responsible to appoint protection officers whose primary function is to provide care and protection of victims of trafficking in persons. The Act also provides for protection of witnesses and also creates an offense in instance where a person negligently disowns the identity of a witness. And take that, Mr. Matewere. The identity of a witness in a case involving trafficking persons or the victim in such cases without any authorization. It also allows any witness to apply for protection where he or she reasonably believes that his or her safety or that of any member of his or her family is threatened by reasons of his or her being a witness in the case. The Act provides for the establishment and also administration of an anti-trafficking fund whose purpose is to help in adequate provision of care and support to victims of trafficking in persons, training of enforcement officers, protection officers, and any other person engaged in any capacity to effect the provision of the Act. In view of the legal provision in the Act, a deliberate initiative has to be made to ensure that such provision are translated into action, hence the importance for this training workshop for health and also medical officers. For health care providers, trafficking in persons is best understood as a serious health risk because as with other forms of violence, it is associated with physical and psychological harm. Here on the background of this training, we are saying the trafficking persons tend to have immediately medical needs, which need to be addressed as a first concern. They may have physical injuries, they may have, as to what you've said, they may have been exposed to the risks of diseases. They may also have been forced to use neurotic or psychoactive drugs as a means of controlling them, or have developed a drug addiction to assist them to cope with the situation. They might also have mental health problems, hence having our officers from Kamuzu Central Hospital, with associated physical conditions. They may have been unaware of sexual health issues and being made to endure unsafe as well as various sexual practices, which increase risk of contracting HIV/AIDS and other sexual transmitted diseases, gonorrhea and syphilis and all those, which medical examination and discussion preferably undertaken in partnership with appropriate NGOs, hence having Matewere here, and can provide a support person and interpreter, a first step so that obvious injuries can be identified and also treated, plan initiated. Mr. Matewere and also Madam Kachimanga, we would like to thank you very much. On behalf of all these persons in trafficking or trafficking persons and all those people whom we were keeping, without you, they couldn't even be in the safe hands as is the case. Maybe if they had to make noise in the hands of the perpetrator, they would have been killed. And this is what we are looking forward. We keep talking with the Director of Social Affairs to say, let's have officers in borders, across borders, in our borders, who are going to help us. But also, I may ask you to have also these people who can be tracing some of these things happening within the borders before they cross the borders into Malawi. So if you can even train some people and even put them in these cross borders, let's say border of Chitipa, Karonga, Nchinji, Nsanje, Mulanje, Mangochi. We have even some of those who are crossing the lake. It might be in Salima, it might be in Kota Kota. It might be also part of those who are the routes which they use apart from the borders itself. So they're also important and paramount that if you can train people and employ them and put them in those, so that we should protect people trafficked into other countries, but also into Malawi. The informed and attentive health care providers can play an important role in assisting and also treating individuals who may have suffered unbreakable, unspeakable, and also repeated abuses. For health practitioners, diagnosing and also treating trafficking persons can pose a range of new challenges related to care provision. In recognition to the need for national guidance, Government of Malawi, under the leadership of His Excellency the State President, Dr. Lazarus Chakwera, and also the Vice President, Dr. Sausilima, they are pleased that the management of Beth Israel Safe Home, Gateway of Hope, organizes this first training for health workers since the enactment of the law in 2015. And on behalf of the Minister of Home Affairs and Minister of Health, would like to thank you very much. And I am here just to show the coordination which is between or among the three ministers, the Minister of Gender, Minister of Home Affairs, and the Minister of Health. The Minister is therefore happy that you could find time to attend this important training. And also today's event is an unique opportunity for us to inspire medical and health workers to join the government of Malawi in providing services to trafficking in persons. We believe that as a nation, we need to adopt a common approach to address common challenges as our basic tenets of bilateral relationship required to adequately implement the Trafficking in Persons Act. I would like to thank His Excellency near guests and also family for the support provided through Beth Israel Safe Home managed by Gateway of Hope team, and also first most important provided for this training workshop. I would like also to thank Mr. Matewere and also the UN ODC for the support and also the training skills which you are going to impart in our officers present this morning. Words fail me to say thanks so much, our officers. Otherwise, we would have said, I have something to do. But it shows that you are also committed, very much committed, to protect our trafficking in persons, or those persons who've been trafficked because of the drugs and the sexual abuses. May God remember you in a special way. We know you are really committed and you do a lot. It doesn't mean that you are there for work, but it's just a calling. Each and every person who is in this department of health, in the hospitals, the nurses and the doctors, the clinicians, they're all there because it is a calling. And we ask the one who called you to help you, to support you, and to listen to whatever your wishes are all about. May you live longer as you continuously supporting the persons in trafficking. May Maxwell Matewera live you longer for the job which you are doing, protecting the Malawians who are being trafficked, but also bringing the relationship is so stronger with other countries, because you are able to protect their people who've been trafficking into our country. It's one way of saying we cannot even condone that, and you are working on behalf of government just to protect the people for those whom we are in relation with. May God remember you in a special way. Madam Kachimanga, you are so unique. We thank you very much, Ma'am. You are a mother, and let God remember you. With this, allow me to officially open the training workshop for our health workers who are going to be trained into the support of our persons in those who've been trafficked. May God remember you and have a blessed day throughout the training. Thanks so much.